Welcome to Creating a Family. Talk about infertility. Today we're going to be talking about a subject that is so important and quite frankly just not talked about, or not talked about enough, that's for sure, or not talked about enough with people outside of your partner. Let's put it that way. The topic, enough teasing here, the topic is the impact of fertility treatment on sexual health. How does fertility treatment affect some of your most intimate relationships? And can it just spoil your enjoyment of sex? You talk to patients and they're going to have, most of them will have a very definite feeling about this. Let me start by telling you that you're going to be noticing some differences in sound. If you are a regular listener, you know that we have been making huge improvements in our sound quality, and we are really proud of that. Please note also our new cover art, our new snazzy look. But today's show is going to be different. The sound is going to be slightly different. One, I'm not in my regular studio, and I don't have my earphones. And these, quite frankly, just aren't as good. So you're going to notice a difference there. But also, this is a re-air of a show we did a year or so ago. But we wanted to bring it back because it is a topic we get a lot of questions on. And the guests are just terrific. Today, we're going to be talking with Dr. Jody Madeira. She's a professor at Indiana University-Bloomington and an expert on law, medicine, and bioethics, and a researcher on the impact of fertility treatment on sexual health. She's also the author of a book called Taking Baby Steps: How Patients and Fertility Clinics Collaborate in Conception. We'll also be talking with Dr. Beth McAvey. She is a reproductive endocrinologist at RMA of New York. And last but certainly not least, we'll be talking with Debra Unger. She is a therapist for over 20 years that specializes in the treatment of couples with infertility. So without further ado, let me bring you this show. As I said, I think you are really going to enjoy it. I wanted to begin with some quotes because I think that they capture so well the poignancy and some of the struggles, the very real struggles that a lot of women have with sex and intimacy after infertility or during treatment of infertility. Here is one. Infertility and infertility treatment ruined sex for me. I no longer have intercourse because of the pain that I think is probably psychosomatic. I did physical therapy for the pain, but it never went away. I also have pain during orgasm now. I had a really enjoyable sex life before infertility, so it's a shame, but I haven't been able to recover. It's been about 5 years like this. The directive to have sex every day, which we were told to do by a fertility doctor, plus miscarriages during that period probably contributed to a feeling like a failure and really just being disgusted by sex. I also feel like infertility changed my relationship to feeling feminine and to my gender for a period of time. This has gotten much better over time, but it hasn't totally healed. Another one, I think having sex is now a reminder in a way that my body doesn't function, and I find sex depressing. I have certainly worked on this in therapy, but it's also hard to find a good therapist who really understands infertility. I'm actually a therapist, and I find it hard to find one. And then someone else who talked about infertility treatment being a disaster for their sex life, and she said, had she known that this might have been the impact that it would have on her in her marriage, she would never have chosen to go down this path. So I think that many women have seen a change in their sexual health as a result of an infertility diagnosis or fertility treatment. But I think it would help to start by asking, and I'm going to direct this to you, Dr. McAvey, if people with infertility are more prone in general to having less sexual desire, and I realize that sexual desire is only one aspect of what we're going to be talking about, but are we blaming a diagnosis of infertility or its treatment when in fact it's really part of the underlying cause or something?
There are obviously several etiologies for infertility. One in particular that comes to mind that certainly could have a real organic reason for sexual dysfunction would be something like endometriosis. So endometriosis is a diagnosis that often is linked to infertility. It is a condition when the endometrial tissue, so the lining with the glands within the lining of the uterus, actually leave the internal portion of the uterus and go elsewhere. So it can go to fallopian tubes, ovaries, rectum, bowel, large bowel, small bowel, the entire sort of side walls inside of the abdomen up to the liver, can go to the lungs, they can go everywhere. But patients who have severe stage endometriosis often have quite significant pelvic pain. So for the non-infertile patient, there's often a lot of sexual dysfunction from the onset due to dyspareunia, pain with intercourse. And so those patients certainly do have much higher rates of infertility at baseline. So yes, again, depending on the etiology and diagnosis of infertility, it can be from the beginning. In general, I would say beyond the diagnosis of endometriosis, women with ovarian reserve issues or male factor infertility, I would say not necessarily.
Well, I was going to ask about low ovarian reserves, which is sometimes called premature menopause. I mean, we certainly have heard that sexual desire changes, if not diminishes, with menopause.
Sure.
With a woman who has had an early onset of menopause be experiencing some of that.
Sure. I mean, it's we do see these patients rarely, thankfully, but so the term premature menopause, sort of technically we've replaced that with the term primary ovarian insufficiency, but it is a diagnosis of essentially menopause prior to the age of 40. So it's actually in very young women. So in late 20s, mid 20s, or early 30s, mid 30s. And essentially it's when there are no more eggs remaining. And so the female doesn't ovulate and then doesn't get a period. Those women experience menopause just like the average female who gets menopause at normal age in this country is around 50. So there are symptoms due to low estrogen levels that can affect sexual health. So vaginal dryness is the big one. Again, dyspareunia or pain with intercourse, hot flashes. So all of those typical vasomotor symptoms can affect, of course. So yes, you are correct. Yes. So in the unfortunate patient that's diagnosed with a premature, failure of the ovary, we do see that.
Okay, so now we know that there's some organic reasons, but let's now talk about some of the impact on sexual health caused by fertility meds, the medication that people are taking to treat their fertility. So I'm going to start with females. How do the standard fertility meds affect sexual health? And let's start with the oral meds. People tend to think of them as, baby meds or the beginning, the more neutral, not the big guns. We could argue that is or is not necessarily a good way to describe them. But let's start with the two that we most often hear about are Clomid and letrozole. So how do they affect sexual desire or sexual health?
Right. So I will say letrozole is more often a kinder drug. I definitely think it has a less significant side effect profile. Clomid is our old gold standard, though, so a lot of practitioners use that more over letrozole, although perhaps a push in the field, to switch that. But so Clomid's, I would say that the most common side effects patients complain about are mood disturbance, headaches, and hot flashing. We certainly know all of that can affect sexual health or desire, to engage in sex. Certainly mood disturbances for sure, and we can speak about that. And then physically also with repetitive Clomid use, patients often complain of also vaginal dryness. So I would say those are the four main things, but most common is the mood disturbance and the hot flashing. Those are the two big ones.
Okay.
Yeah,
All right.
and
So letrozole
letrozole,
perhaps less than.
yeah, perhaps less. It should not cause vaginal dryness. That's one of the benefits. It doesn't affect, uterus also. But patients still often complain of hot flashes with letrozole, less, if just from my personal practice, less mood changes. And then the other thing I should mention actually with Clomid, the other thing sometimes patients complain about is breast tenderness. And so again, trying to engage in sort of normal, spontaneous sex. If your breasts are very tender, you may not want them touched. It all goes together.
Okay. Now let's move to the medications that would be used primarily with IVF, but also with IUI. So
right.
how do they impact?
So typically IVF medications are injection medications. They are injectable gonadotropins. That's what we call them as a sort of general term. And the idea for IVF medications is to purposefully recruit or harvest as many eggs as we can in about a week's time in the safest manner as possible. So instead of just making, let's say, 1 or 2 eggs like we would on Clomid or letrozole when you're just doing oral pills for simple ovulation induction, when you move to IVF, we're purposely trying to get 10 eggs, 12 eggs, 15 eggs, whatever your body's able to give. So there are a lot more physical symptoms patients feel, and obviously the most common would be a lot of pelvic pressure and bloating. I will tell you, as far as our recommendation for engaging in sex during an IVF cycle, the answer is actually no. So we actually say no intercourse during an IVF stimulation. So patients really should not be engaging for multiple reasons. There's several reasons why, but one of them from the ovarian stimulation side is that if the ovary itself is quite large, obviously there could be a lot of discomfort with sex. Their patients themselves are at risk of having something called a torsion, right? So twisting the ovary. So we just don't want a lot of physical activity. So we say no intercourse during and no exercising. So,
well,
patients,
you also might have multiple. At that point, you have hopefully many eggs that are fertile, and talk about a rib for a large order, multiple births. For gracious sakes, that's if no other reason.
Most of our cycles, but you're correct. Most of our cycles in today's day, we're freezing all of the embryos and then doing the transfer in the following period when the patient is feeling much more normal and back down to physiologic state, and we test a lot of embryos now. But you are 100% correct. There are some patients still doing fresh transfer cycles, and imagine if you go and you have 15 follicles at a retrieval, and we harvest 14, or you think you got them all and you didn't, and then they have intercourse. You're absolutely right, and you do a transfer, you can end up having birth, and we've all seen that. I mean, I've seen it in practice, several times actually. So you're correct.
Okay.
Something to be worried about.
Now to move on to the male, what fertility medications are prescribed for male factor infertility, and how do they affect sexual drive or sexual health in other ways?
Right. So. So 2 things that we think about. I mean, one is, is there, does the male partner actually have erectile dysfunction, right? So actual inability to perform sort of sexual act, having an erection or penetrating the female, or properly ejaculating. So all of that is actually a very important part of the detailed history when you meet a couple. There's actually a fair amount of erectile dysfunction out there. It's very important to ask. If the answer is yes, obviously an appropriate referral to a urologist, and specifically, if possible and available in your area, a fertility urologist. So there are urologists that are our counterparts and specialize in infertility and reproductive care. So if that's present, we refer. And then secondly, if there is notable oligospermia, meaning decreased sperm count, significant, we would call that severe oligospermia on a semen analysis, meaning taking the sample from the male and analyzing it to see what the count of the sperm is. We often will also refer. Now, if there is presence of severe oligospermia, the question is it due to hypogonadism, meaning low testosterone levels. So, low testosterone that regulates sperm production. If it's low, it's going to be low. And so for those particular men who are diagnosed with low testosterone in the setting of low sperm count, the urologist actually will give them Clomid. So they will give the male partners oral Clomid, which does a very nice job of raising endogenous or internal testosterone levels with the hope that it helps to regenerate higher counts.
It's fascinating, isn't it? But we've also heard reports, and again, these are anecdotal, so I'd like to get your input, that that Clomid decreases a male's sex drive and makes it harder to perform or at least get in the mood. Is that just anecdotal, or is that actually been supported by evidence?
I don't know the answer to that. I would probably defer to my counterpart, Dr. Barhama, from that regard. I would say at that point, if the man is diagnosed with severe oligospermia, they're under the care of the urologist. I think that it's probably multifactorial at that point. I wouldn't be surprised, though. Clomid for females has a significant side effect profile. I would think it would do the same for the male. So I wouldn't be surprised.
I wouldn't either, just hearing that, and it's interesting when we think of fertility meds, it's almost universal that people think, oh, it's just Clomid. It's like that's the beginning. And so many women find Clomid harder to handle than the injectable gonadotropins. I mean, it's one of those interesting, not all, I'm not going to say that way. All right. Now, we've talked some about the physiology of infertility and how that can, and as well as the treatment, and how that can physically affect your sexual health and your sexual desire. But now I want to move into the emotional realm and the emotional impact. When we were having this discussion, Creating a Family has a very large online support group. It's a closed group, which, if anybody is interested, we'd love to have you join us. It's on Facebook, a closed group, so you have to request to join. Go to Creating a Family. Go to facebook.com/groups/creating a family. We'd love to have you join us. Anyway, we were having a great discussion on this exact topic last week, I guess it was, maybe the week before. And a couple of words came up over and over. I mean, it was almost uncanny how often they came up. Talking about, the question was, how did infertility treatment impact your sex life? It became a chore. It came up over and over again. Killed the romance. Another thing that came up. Right. An interesting one, that sex feels pointless now. It's just, and those three things came up so often. Debra Unger, I wanted to get you involved now, since you're often treating patients and couples who are experiencing some of this. How common is it for women and men? I must say, in our discussion, it was almost predominantly women, but I'm without a doubt. But many of them were speaking on behalf of their husbands. So anyway, let's talk about that. How common is it to feel like there is no joy in our bedroom anymore because now all of a sudden it's just work? Is that a common response?
Well, thank you for having me on the show. And yes, I think I would say that is something I probably hear across the board. That couples, and like you said, a lot of times it might just be the woman that decides to come in for counseling, will say that this is impacting their sex life. And as we all know, going through any type of infertility treatment enhances our stress level. So that's going to have an impact on how we connect with our partner, how we feel about ourselves, our body. So yeah, I do see that across the board. And I say that because I would like to help people understand, that it's a normal response. And then when we know that it's a normal response, that can become sort of a starting point for where we can address other issues that are coming into play.
One of the things that becomes, I was really glad you mentioned stress, because heaven only knows infertility and infertility treatment are stressful, and we, like you say, we all know that stress can put a kibosh on desire, and as well as the timing and everything else. One of the other things that I thought was interesting that came up was the fact that oftentimes infertility makes us feel like failures. And one woman said it really interestingly. She said, "We've had at least 48 cycles of trying that failed." That's a lot of grief tied to sex. And by cycles, I don't think she means 48 IVF cycles. I really don't know, but I'm assuming she means that they've been trying for 48 months. And so that, cycle, a monthly cycle. And I thought that was so poignant. That's a lot of grief tied up to sex. That's powerful.
Absolutely.
Yeah, and she's right.
Absolutely. Yeah.
So,
and you already addressed that by starting. A lot of times couples do start with Clomid, and then they move into the injectable cycles, and then they might end up in the IVF cycles. So that's really very easy to imagine. And actually, pre-Clomid, they might have had timed intercourse. So I see couples that could have been in treatment or trying for, let's say, going back 3 or 4 years. That would be a lot of grief. And unfortunately, it becomes compounded grief when they don't seek help at an earlier stage and start addressing some of those issues, those disappointments, everything that goes along with trying and not succeeding.
Right.
Yeah, trying. And let's go back and talk just briefly about the impact of something as seemingly benign as time cycles. Dr. McAvey, let me bring you in and say, all right, at what point are you recommending time cycles, and at what point once people are seeking treatment, does that become less of an issue, if ever?
So it's interesting. I mean, I think there's been a transition, maybe because of this concept of the iPhone. I sometimes sort of age myself. When I started in this, I'm not that old, but when I started medicine, the iPhone didn't exist. So patients come into the office now. It's very different than it was, 10 years ago. They come in with an entire year's worth of tracking on apps. The typical infertility patient isn't just walking in saying, I don't know where my cycle is. They're coming in with literally 12 months of here are the days that I was ovulating, based on this sophisticated app or ovulation sticks. So the real truth of the matter is usually when they come to our office, unless it's something, different, erectile dysfunction or the cycle is completely off, they have been timed. They have already been doing timed cycles. So, for the patient that gets a period every month, they've been doing their time cycles, for 6 to 12 months before they come in. So the real truth is, unless it's just a simple erectile dysfunction with the male partner, and we just want to do natural cycle timed, let's say, IUIs or something along that lines, usually patients are going into some sort of medicated cycle.
And Clomid would be or any of them, I should say, the oral meds. There is timed intercourse associated with that. But less,
so we either we would either recommend timed intercourse or IUI, which is intrauterine insemination.
Okay.
So for the young female, sorry, go ahead.
Well, no, that's okay. I was going to say, let's talk some about the emotional impact of not the emotional. Let me say the impact on sexual health, certainly spontaneity, on timed intercourse. And Debra, I want to get your thoughts on this. And I think in particular, let's take this past somebody who, let's keep in mind, let's put it this way, let's keep in mind that most of the people that we're talking about have been doing timed intercourse for at least a year. If they're older, they would have hopefully not would have taken our advice and gotten treatment, before that period of time.
Right.
It's a real push for us. But so it's I think it's important for those who have not experienced to understand that this is not a matter of, we need to, we're going to have to make certain that we have sex over these 2 days in this particular month. it's gone beyond that. It's been month after month after month that people are doing this.
Yes, exactly.
So why does timing? Why would that alone have make somebody feel bad about sex?
Well, I think that nobody really wants to feel pressure around having sex. It's just not a way that we tend to approach that, and it's not something that a couple comes together and they want to enjoy their sex life, and anything that imposes additional pressure around that can really just have a natural diminishing of your drive. It can exacerbate anxiety, create just discomfort around the topic. So I think it's just really important for couples that are going through, whatever stage they're at in their infertility treatment, to try to step away from that and really look more into their relationship and how they're connecting, how they're communicating around these issues. And they almost need to kind of rebuild an understanding about intimacy between them as a couple. And sort of acknowledging, we are dealing with all of these other issues and kind of coming together around that. Does that make sense? To take the pressure off, and to revisit the relationship, communicating, supporting each other through this difficult time. And then through that, you're rebuilding a different type of intimacy that can help help couples come together and enjoy sex again.
And how do you go about rebuilding your idea of intimacy when that's something that's usually that has been so it's been such a part of your integral from the very beginning usually?
Yes. Well, I think I do a lot of psychoeducational work with couples because, again, whenever anybody kind of bumps up against infertility, we're all caught off guard. I don't think anyone is ever prepared for this. And it's sort of this thing that we run into, and it can often spiral. We don't see it coming. We don't understand it. So we're a lot of times just, as you know, looking to the internet, trying to educate ourselves on these issues. But often couples, when they first bump up against this, they don't have the information they need, and it becomes, a lot of fear comes into play. So when I see couples, when they finally get to me, they've been in it for a while, just like when they get to a reproductive endocrinologist, they've been in it for a while, they've been alone, they've been scared. And so really talking with people about expectations and helping to normalize what they're going through, and that, yes, this is a scary time. Yes, there's a lot of information out there. It can be overwhelming. Your stress response is normal. And when we don't know what we're going to face, anxiety comes into play, and just helping couples understand that what they're going through really is a normal response. They can begin to turn to each other for support in a new way.
It's funny, in our discussion, in our discussion online, it was so clear that just knowing that others were experiencing or had experienced this was so powerful, and it was nice to see at some point there was almost some humor. Somebody was typing in, oh, what are you talking about? What is this sex life thing you're talking about? Who has that? So it just normalized it, and normalization makes you feel like, okay, I'm not alone in this, and I can cope with this, or I can conquer this, or and one of the things that I thought about when you spoke is that earlier when Dr. McAvey was speaking, she said that you'd be surprised at how common erectile dysfunction is. Well, there is, I think, for a lot of men, there is the performance failure. A fear of performance failure. I'm not going to be able to maintain an erection. This is the most important day of the month. It's either now or never. And oh, God, she's going to be so sad if we don't do it. She'll blame me. And talk about a buzzkill, but that makes it really hard. So first of all, let me ask Dr. McAvey, when you're seeing these people in your office, probably before Debra Unger is seeing them in her practice, or maybe at the same time.
Right.
Is there anything you can say or to help people take some of the focus off of the immediacy of performance at this moment? You got to do it and forget about enjoyment or whatever. Just do it, type of thing.
Right. I mean, it's a hard one because if it's true ED, it's true ED. I mean, we always make very sort of contingent backup plans. So if I suspect that there is an issue, again, you sort of try not to make it a big deal, but you'll say, maybe it's best over the next few weeks at a time that's good for you, not a specific day. You could give a sperm sample and we could freeze it so that perhaps on the day that we need it, if there is an issue, then we have what we need. So there are ways that you can take a lot of the pressure off. And that sometimes works actually quite nice. So if there's any, and so often the patients will, oh yes, that sounds great. And then just that, knowing that there is a backup plan, we always try for a fresh sample. If it doesn't work, not a big deal. We have what we need. So it does take a lot of the pressure off.
Yeah, exactly. Yeah. Anything we can do. Debra, other ideas that can take the pressure off of the guy, especially if they're having erectile inadequacies, if not total dysfunction?
Well, I wouldn't say that it's more the male. I think women also feel very uncomfortable at times. But with either partner, if they are feeling that pressure, again, I would kind of pull it back and talk more about what they're dealing with emotionally in the relationship and how they can come together and support each other better through this very challenging time. I can't say enough about that support that couples really need and deserve when they're going through all of this information gathering and trying to figure out how to navigate all the different treatment options. And that the other thing I wanted to bring up, though, is thinking about when I say that couples need support, a lot of times men and women have very different emotional responses to the treatment. And I see a lot more women in my practice than I see men. But when women and men come in together as a couple, the woman tends to be express her concern and worries more readily, whereas the male partner comes in and is trying to be strong and supportive of her emotional response. So he's repressing his own fears, which could translate into some erectile issues when it comes to performance anxiety. But if a man is coming in, a husband, in this strong, I am here to support her no matter what she goes through role, and she is in this role of worrying, then a lot of times couples I see them spiraling away from each other because she's worrying more for the two of them. She's doing all the worrying in the relationship. He's doing all of the caretaking. And so then they spiral away from one another. I try to talk about that dynamic because I see it so often in my practice. And I ask that maybe the male partner considers being more open about his concerns. And I think that when that can happen, it actually comforts the female partner in a way that might allay her worries more than him saying, it's going to be okay, I'm here, I'm strong for you. Now I'm using my hands, which I can't show you on the radio, but where they spiral up and down. The woman is spiraling up, the man is spiraling away in a downward place. But when he can share his concerns, he can come up to closer to where she is, and she can come down from that role of worrier for the two of them. And that in and of itself helps them connect in a much deeper way that might support a better relationship, in the bedroom. Yeah.
Absolutely. You are listening to Creating a Family, talk about infertility and adoption. And today we are talking about the impact of infertility and infertility treatment on sexual health. This show, as well as all the resources provided by Creating a Family, and we do have a lot of resources, could not happen without the generous support of our partners who believe in our mission of providing unbiased, medically accurate information to the patient community. One of our great sponsors is Reproductive Medicine Associates of New York. They are a full-service fertility center specializing in vitro fertilization, egg donation, egg and embryo freezing, LGBTQ family building, reproductive surgeries, and male reproductive medicine. Highly individualized patient care is offered through 13 reproductive endocrinologists and fertility specialists, as well as a urologist and their support team. And we thank them for their support. I want to bring in now Dr. Jody Madeira. She is a professor at Indiana University-Bloomington. She is an expert on law and medicine and bioethics and a researcher on the impact of fertility treatment on sexual health. And she is the author of an upcoming book that will be published this year, Taking Baby Steps, How Patients and Fertility Clinics Collaborate in Conception. I wanted to bring Dr. Madeira in now to talk with us some about her research on the impact of fertility treatment on health. And she is having to call from a cell phone, so we're keeping our fingers crossed as to the quality. So, Dr. Madeira, can you tell us some about your research on this as to how fertility treatment impacts kind of generally sexual health?
Yes. So I find it
Oh, we've got it. Let's see. Let's try, and we're going to try to give this a go. I think our connection is not terribly good, but let's give it a try. And if I interrupt, it's because we're not the reception is just not good enough to continue. But let's give it a try.
Okay.
Yeah, I think we're going to have to try one more time.
Okay.
Yeah. Okay.
Hello.
Yeah.
Hello.
Now you're sounding much better.
Okay.
Yes. Go ahead.
Yes. Okay. So actually, the issue of infertility affecting reproduction actually starts even before they begin treatment. I think it's often compounded by the time they start treatment, and it's especially compounded if they don't seek treatment in a timely manner. So what happens is people try and they don't anticipate a problem, but nonetheless have trouble, and it becomes something which they might not know a lot about. They might not know how to work through it. They might feel weird talking to friends about reproductive issues especially after these friends have children already and it was effortless. These are very private matters. And men in particular might not want their wives to disclose that he's having perhaps doubts. He might be having trouble getting an erection because they're just trying so hard. They might not know even the time of the month that they're fertile. And so I think a lot of it stems from a lack of knowledge.
I think you may be right. And, one of the interesting things that came up in a number of times and when we've had online discussions in our support group is and I think this is so interesting, women not telling, and again, I think this is more of the before they're actually in fertility treatment with a reproductive endocrinologist, but women not telling their partner during their fertile time. And they're doing it because they don't want to lose the spontaneity, and they're losing the spontaneity, but they don't want to lose the feeling of romance. They also don't want their husbands to feel the pressure, and I think it's also a little bit because they're taking full ownership of the couple's infertility, and we could talk some about that. Debra Unger has already alluded to that being a fairly common thing. Do you see that in your research, women taking ownership of at least the treatment of their infertility? Is that a common thing that you see? This is to Dr. Madeira. Oops, I think we may have lost her.
Okay. A lack of knowledge affects infertility? I think is that your question? Yes.
No, that women take ownership of the infertility in a relationship.
I definitely don't even think it's their fault.
Well, and sometimes it is, and sometimes
more in my
it
experience. My book, right. No, but they tend to think it's their fault, even if it's not.
Right. Yes.
because we put, both cultural ownership of reproduction on women. This is, supposedly women's work. And again, it's not in all couples, but I think this is something that you see through many patients. So for my book, I interviewed 130 patients and 90 physicians, and almost everyone affirmed that, there's this kind of cultural narrative about how you're supposed to have a child. And it's supposed to take place in love and supposed to be, like, as you mentioned, very romantic. And the farther these couples get from that reality, the more it starts to problematize that narrative.
It starts to what? Traumatize? Is that what you said?
Yes. The more it starts to problematize that narrative. So then they're not creating a child in the circumstances they wanted to. And again, it just creates like a spiral of guilt and shame that not only is the sexual act not fulfilling, not only are they not conceiving, so the end goal is not being realized, but also just the very, nothing's turning out the way they imagined.
Right. Yeah. And then that goes back to the spiraling that Debra was talking about. Everything, and then the feeling of this is not how this is not following the cultural narrative, and then that starts adding pressure and stress, and then that spirals and into perhaps performance anxiety or just lack of desire. One of the things that actually the quote at the very beginning of the show alluded to, and I want to talk some about that. And she said it affected her relationship to feeling feminine and to her gender. And I think that perhaps not said quite so eloquently, but I do believe that infertility affects how we feel as a woman or as a man. Debra Unger, can you talk some about, do you see that in your practice as well?
Yes, I think that I think often it just creates a cascade of, as Jody was saying, of doubt, of shame, and people are kind of frantically trying to figure out and navigate this unexpected journey that they have to take on. I actually wanted to piggyback, though, on your last question about how it affects women, and to add whether women feel more responsible. What I tend to see is that women take on the lion's share of the research and searching for answers and for treatment protocols. And I see that happen almost just 100% across the board. So whether it affects their identity as a woman or not, this is what they're doing with that, with this, the shock and the despair of the reality that they're stuck. And I think that the research can be a wonderful way to feel empowered and to try to navigate what to do with, all the different options. But sometimes it does go a little bit too far, and it can exacerbate anxiety and make it, a more fearful journey. So I work a lot with people on trying to find the right balance. And yes, if they feel responsible for what's happening, it's their behaviors that can kind of trigger more fears and anxiety, and we want to make sure that they find the right balance. Does that make sense?
It does. Another underlying thread that, quite frankly, I wouldn't necessarily have thought about, and that is the impact of, I think, perhaps more infertility or the failure to conceive, the impact that has on body image, and I think that's in some ways maybe tied into how we feel about ourselves as women. And before Dr. Madeira, I'm going to turn this over to you, but before I say that, let me quickly mention that I think, while I think infertility certainly can affect a woman's feeling of femininity, I think that going back to the term that Dr. Madeira used, cultural narrative, I think our cultural narrative, it makes it such that many, many men feel like infertility, if it's a male factor, affects their masculinity, and I think that we can't overlook that. But I wanted to talk a little bit about the impact on body image and how we view ourselves as a body. One woman in the group, Dr. Madeira, said after my diagnosis, I've really let myself go, and I'm very unhappy with how I look right now. I have zero. She's no longer confident, as to who she is, and that's reflected in how she feels about her body. Is this something that you, in your interviews, did you touch on the body image part?
Yes, absolutely. And what happens with body image is, so women start feeling bad about themselves. It can actually create a lack of sexual desire. It can actually lead to problems in the relationship, but it goes farther. So first of all, it can just lead to feeling unsexy. That's kind of the least worries that people have. When it starts to get worse over time, they get increasingly worried, increasingly anxious, increasingly guilty. They actually start to feel that they're broken. And the feeling of brokenness actually is what really is haunting. So when women have said to me in interviews, for example, I told my husband he could exchange me for a better model. I told him that I was, his time was not up under the Lemon Law. And again, this just reaffirms that women are not products, right? And the third thing I'll say about that is when you actually start to get into infertility treatment and you start to experience side effects from the drugs, whether it's hormonal or whether it's actually gaining weight, that can even make this worse.
Well, it's a good point about, we did talk with Dr. McAvey at the beginning, and Dr. McAvey, I really had forgotten to even ask about that. Is weight gain associated with, and let's be honest, weight gain does not affect many women or men's feelings of sexiness or worthwhileness, and nor should it.
Right.
However,
right.
It is a valid point, especially in
right.
our culture. So is there does the medication, any of the meds, cause us to gain weight?
I mean, typically the IVF medications can cause water retention, and there is some weight gain, a few pounds. I mean, nothing so drastic. And I often tell patients after the procedure, the body will actually hopefully release the water, and the weight will become back to normal. But yes, we do see some water retention and weight gain from the injectable medications, from the IVF in particular. So for patients that are undergoing, consecutive cycles, it can be an additive concern, for the female, of course.
Yeah. Well, the man too. Before
can I add?
Yeah. Yeah, please.
Yeah. Well, I was just going to add that a lot of times, because they're going through stress, people might turn to food for comfort, and we need, and also there's a fear I tend to see of exercise. I don't want to jar my body right now. I want to stay as still as possible so that things work out smoothly.
Yep.
So I think it's really important to encourage patients to continue to eat healthily and, keep a strong and healthy relationship with their eating habits, and also to get regular exercise, which can have the added benefit of reducing the stress. So,
Yeah,
and Dr. McAvey, we don't. Dr.
Yeah.
McAvey, we don't. From an exercise standpoint, there is the jostling. It's a really good point, but there's also the concern about, but women who exercise aren't going to ovulate. That's the how much of an issue is that really?
It's rarely an issue, except obviously in the extreme exerciser or the patient that is food restricting. So the very low BMI patients, so low body mass index, height, weight as a function of height. Those patients, if it's quite low, it can inhibit any sort of spontaneous ovulation. So, but that's a longer standing issue, usually ongoing with the patient for decade, for a long time, not just showing up in our office with that from a short period of time.
That's extreme exercise, and so for the
Correct.
average person,
yep. We always encourage, healthy weight, healthy eating habits. We actually have a dietitian because we feel it is so important, that is available to all of our patients to just help with questions or advice or dietary, advice, and for those, patients undergoing treatments, and it's actually quite nice, additive. I mean, I'm assuming many practices have, but we definitely think that it's important.
Yeah, and we've done a lot on that as well about the impact of diet. Dr. Madeira, I'm curious to know if in your interviews you ask how long it takes to get back to a normal sex life once treatment is finished. We ask this question, not really. We do more formalized surveys frequently of our audience, but this one was more just in passing, so it wasn't very formal. But we heard anything from 6 months to not until we had a baby or not until we adopted, and then a number of people said never. It never went back. Did you ask this question about how long it took to get back to normal, whatever normal was for you, normal sexual health?
Yes, I did. And actually, sometimes there was a new normal. Sometimes they kind of could not go back to where they were before. But interestingly enough, some would not have had it either way because they defined themselves as more happy, more satisfied after they become closer. They become able to discuss these issues. And perhaps, and this is kind of bordering off infertility, but because they can discuss infertility, perhaps they discuss other likes and dislikes that they've had, but they've never shared. So this kind of opens up a watershed at some point, opens up the floodgates, and sometimes you really get lots of communication about likes and dislikes and desires, and actually things get better. But in terms of the time, I think it really depends upon how much of an impact the infertility has had upon the relations that a couple has. Sometimes it's a profound impact and it might take longer. In terms of length of time, people mention anywhere from a few months to years. And again, the years would be people who are still going through the infertility.
Yeah, and we've seen that too. And, I'm glad that you mentioned that because I have this later for us to talk about. That it was interesting to me that a number of people came back and said, for us, the impact really wasn't negative. Some talked about how they each month, even though the odds were very, very slim, there was that spark of hope. And they didn't find it as the roller coaster of despair following the spark of hope. They really did view it as something. And one woman said, we actually our sexual frequency really increased, and it was very enjoyable for both of us. And others talked about how the struggle brought them closer. And this is, I think, what you were alluding to, Dr. Madeira, encouraged them to seek each other out. And then Debra Unger mentioned that, oftentimes it's encouraging them to get into treatment. And just the treatment alone has allowed them to feel closer as a couple, and that has improved their sex life. So it's important to realize that it's not, it doesn't necessarily mean that you're never going to get back to whatever normal is. Let me stop for a moment and to remind people that you are listening to Creating a Family, talk about infertility and adoption. And today we're talking about the impact of infertility and infertility treatment on sexual health. I mentioned that our show, as well as our other resources, are brought to you by our partners. Another one of our partners is Manhattan Cryobank. They are dedicated to helping clients have healthy babies by analyzing a client's DNA in combination with the DNA of prospective sperm donors to provide the client with a personalized catalog of safer donor matches. And in addition to their sperm donation services, Manhattan Cryobank also offers a full range of andrology and fertility preservation as well. Before, it would be remiss of us not to talk about, so far we've mainly been talking about heterosexual couples. Dr. McAvey, I struggle to think. I would think that at least with lesbian couples, that some of the same issues would be there, but perhaps I'm wrong. Do you see that the impact of fertility and fertility treatment on sexual health differs with your clients that are LGBTQ?
Ooh, that's a good question. I think that, obviously any couple, male to female or female that are struggling with infertility, there is a lot of added stress and certainly will impact just daily living, and obviously that includes sexual function. Obviously when it's a female couple, we're not dealing with actual performance the anxiety
Right.
issues.
But lack of sex,
It's likely
lack of
more
sexual desire.
intimacy.
Yeah.
Right. So it's more intimacy issues. And I would think the same. So I think, for a female couple struggling, if it's going on to, a handful of months, I'm sure there's certainly an impact on intimacy issues. Yeah.
And I would guess with a male-male couple, theirs is obviously not, if they're using treatment, it's through a surrogacy. But I would think
Right.
that going back to what Debra was saying earlier, it's still stressful. And stress can
Correct.
impact
Yeah, of course.
intimacy. And so, so
course.
it can affect, less from a medical standpoint, obviously, but it can affect. I wanted to come back to some of the, this I think comes to how it affects how fertility and fertility treatment affects relationships. Some of the things that we've heard from our community is the women feeling resentful that they're doing so much, and he's complaining about having to have sex, or having the pressure. Or one husband said, you're not making it special for me, and she was like, well, what do you think? It's special for me? Get over yourself. So, Debra, let's talk a little about that. Just a mismatch. Both, well, at least the woman feeling resentful. Both are probably in both of those kind of scenarios. Both partners feeling underappreciated and resentful. Thoughts on how people can get past that, which is a very common feeling.
That's a great question. I think really helping each other, supporting each other through this difficult time, and understanding, that they're both experiencing maybe a different set of stressors. And we talked earlier about how a woman might feel the stigma that she's not a woman, or a male partner feels that he's inadequate if it's his diagnosis that holds him back. I think it really comes down to communicating and learning that we all have different stress responses, and we need support in different ways when we're going through this stressful journey together. And instead of, having it be, as I talked about earlier, the male partner maybe supporting and playing that strong supportive role, and the woman doing all of the research and carrying the stress for the couple, when they can talk about the details together and then equalize that, sharing the responsibility in some other way, that's going to improve the relationship in the end. That it's okay that we both do our share of worrying, and it's okay that we both do our share of supporting each other through this. And I think that that's where we come together, couples come together and face the journey in a more equalized way, and that can do all kinds of things for the relationship. So I can't speak enough about how they have to find maybe a new balance between them as to how they each deal with stress and how they support each other through the journey.
And that knowledge alone not only improves sexual intimacy, or intimacy in general, which can lead to sexual intimacy, but it can also be used throughout their life, because although this is a highly stressful event, there will be others, and if they are successful and are able to parent, heaven only knows there'll be a lot of stressful events coming up. I wanted to speak about an issue that came up over and over again, and it's that after treatment is over, sometimes after successful treatment, or unsuccessful treatment, or adoption, that people routinely talked about, I'm over it. I'm past thinking about it. I'm past the stress. We're no longer trying, except every month I can't help but now know when my fertile time is. I can't help, I notice my cervical mucus. I notice my feelings. I can feel the ovaries or whatever. I've been so attuned to it for so long. There's no way I'm not going to know. And there's no way that I'm not going to want to have sex. And then if I do have sex, then there's no way that I cannot, on some very small level perhaps, but jump back on that roller coaster of hope and despair. And it's so even well after, sometimes even when they're thinking they're not even actively wanting to add another child to their family, they still talk about the emotional roller coaster monthly because they're still tuned in. Let me start with you, Dr. Madeira, on that one. Even after the fact, trying to unconnect yourself with your body's fertile time and the expectation that maybe just this once it will happen the way it's supposed to.
Right. So I think women do get more in touch with their bodies when they're going through fertility treatments. And eventually, we talked about a lot of very negative processes. Eventually, most people, the vast majority, I think, do come out the other side with more self-awareness, more bodily awareness. The one thing that's really difficult, I think, is sometimes it's hard to get faith back in your cycle. It's hard to know what's going to happen. In my own case, I'll just speak personally for a second. We had triplets when I was 30. I did not ovulate beforehand because I had a miscarriage. And I didn't know if I had when I had the triplets, whether the clock would be reset, what my body would do. So I think there's this period of waiting, and you can see, just what happens. And I think that period of waiting is often very painful. But then if things do turn out well, if they resume, if things start up as they can, what's really interesting is there's this almost very common story out there about women who are able to conceive naturally. Particularly if they've had unexplained infertility, either after going through infertility treatments and thinking that they would not be successful, or conceiving through infertility. So you do see that.
You do, but I'm always very cautious because the reality is that's the exception, not the rule, and we certainly see it in the world of adoption, where people treat the idea of adoption as some type of infertility elixir, that just adopt and you're going to get pregnant. Well, in fact, there's been some research on that, and no, you're not more likely. I mean, yes, even in typical infertility patients, there is a small percent chance, but there's a chance, and so the statistics would bear out that. So I'm always just a little cautious that people don't. Let me ask you this. It didn't necessarily come up in recent discussions, but I certainly have heard this talked about not infrequently, although I still think it's probably not terribly common, and that is women choosing to either have their tubes tied or have their husbands go through a vasectomy, even though they're infertile, but feeling that it is the only way they know of to stop this. The monthly expectation and just wanting to get back to normal and feeling like this is the only way. Thoughts on this, Debra Unger?
Oh, I haven't seen that. That's a very that when you shared that, a rush of pain came to me to think that a couple goes through everything they've been through, and that they haven't been able to come through that, supporting each other and having worked through that, the shame and the grief cycles that they're going through. And it just made me think, wow, those couples probably would benefit from, honestly, going to counseling. I know that I'm biased as a mental health practitioner, but when you come through it at the other end and you feel this trauma, these unresolved feelings of grief and fear and angst, I think we are at a place where the couple should maybe talk about how can we find peace in this journey, and how do we resolve these unresolved feelings of grief. And really, I'm thinking of it as sort of an ongoing, it's like a PTSD response, right? That you're still haunted by the trauma that you went through. And I would turn first to a counselor to talk about the leftover and unresolved feelings before resorting to a medical intervention at that later stage.
Dr. Madeira, any final thoughts on, you'll get the last word, any final thoughts in your research on methods that people have used, including sterilization, to help them cope after they no longer want to get pregnant with are not actively seeking to get pregnant, with the monthly hope despair cycle?
Yes, I do think, no, actually, I have seen that. Many of the women I spoke with said that after they were done trying, they would certainly obtain procedures or take permanent steps so that they wouldn't be surprised. They felt for some reason it was unbearably painful to be surprised after years of trying, which is kind of the opposite of what you would expect to hear. But they just wanted that, I don't like this term generally, but closure of knowing that it was very, very unlikely to happen. So I think that can be something that they have to grapple with. But it's a measure of reestablishing control over their fertility when they've lacked control over their fertility for so long. And certainly after they are done having a family, that they are very eager to take control again because it's been denied to them.
Yep, I think you're on to something very much. Well, thank you so much, Dr. Jody Madeira, Dr. Beth McAvey, and Debra Unger for being with us today to talk about the impact of fertility and infertility and its treatment on sexual health.